If you have a large ovarian cyst or chocolate cyst or endometrioma and you're worried about chances of pregnancy or infertility, then you are not alone in this journey. Never lose hope. Here is a short patient story. A 24-year-old girl with severe menstrual cramps, period cramps, and persistent gastric issues and spotting had presented to the clinic. Her ultrasonography revealed 7 centimeter chocolate cyst or endometrial ovarian cyst in the left ovary. And she had been to a gynecologist. The line of treatment was OCPs and hormone estrogen lowering medicines. For about 1.5 years, she was under treatment. And to her surprise, there was no change in the cyst. Rather, it had grown to about 10 centimeters. Why does it happen? Here, the tissue, endometrial tissue, which is the lining of the uterus, which lines your uterus, grows abnormally in parts other than uterus, like your ovaries or fallopian tubes. Okay, and every month the period blood gets collected into this cyst, and people with a similar family history and hormonal imbalance, they are at higher risk. And this is the most common causes, one of the leading causes of infertility in women in the age group of 20s and 30s. For ladies, cyst was very large. It was 10 centimeter. 10 centimeter is like Nagpur orange, right? Roughly the size of a big orange. So there were naturally complications, risk of complications like torsion of the cyst. Torsion is twisting of the cyst or rupture of the cyst, which is an emergency. So her gynecologist had warned her of infertility, lower chances of pregnancy, fallopian tube blockage, and hence suggested her to go for oophorectomy, that is removal of ovary, or maybe during the procedure, if the case demands, she may have to go for hysterectomy also, which is the removal of uterus, because the cyst is quite large, and in future there are chances there may be less room or less space in the uterus for the growing baby once she is married. Okay, but our patient, she refused surgery since she was still unmarried. She refused surgery. She wanted to give homeopathy a try. She had come to us, and homeopathic medicines do not dissolve the cyst completely, but it helps to reduce the chronic endometrial inflammation, bring about hormonal balance, and work on immunity modification. Okay, and in about 2 years time, the cyst reduced to around 5 centimeter, from 10 centimeters to 5 centimeter. Later she got married, conceived naturally, and delivered a healthy baby. Hope this information is useful to you. Follow me for more.